In 1988, Southwest Center for HIV-AIDS was founded under the name Body Positive by a young activist named Kirk Baxter. Kirk was frustrated by the national and local apathy surrounding the growing AIDS epidemic and decided to take action against the disease and serve those impacted by its devastating effects. 25 years later, Southwest Center is still on the front lines of the battle against HIV and AIDS. Our mission is to prevent and reduce infection, improve the quality of life for those impacted by the disease, and contribute to worldwide research. At Southwest Center for HIV-AIDS, we are focusing on expanding three key priorities. First, increasing HIV testing and prevention education. Second, connecting those who are HIV positive to treatment and support. And third, growing our clinical trials program with a focus on HIV and other sexually transmitted infections and related conditions. Our new community center, the Bob and Renee Parsons Foundation Center for Health, Education, and Wellness, is located in downtown Phoenix and is designed to accomplish many of our goals. This center, which is the only one of its kind in the Southwest, brings our services together under one roof with a primary medical care clinic, lab work, and a pharmacy. All of these services, combined with shared workspace for other community organizations, classrooms, and a black box theater, leave Southwest Center poised to provide truly integrated care while serving as a unique community health and education center. Southwest Center for HIV-AIDS is the only organization in the southwestern U.S. that offers the unique combination of prevention and education programs, health and wellness services, and clinical trials research. We're a relatively small agency, yet our programs and accomplishments read like those of a much larger organization. For example, our well-respected clinical trials program is something that you would typically find only in a hospital or university setting. Our Community Health and Education Center was partially funded through a voter-approved bond from the City of Phoenix, demonstrating a high level of confidence in our ability to impact not only those who are affected by HIV and AIDS, but also the revitalization of downtown Phoenix. This unique center provides an opportunity for us to implement new programs that have the potential to make a difference at the local and national level. A number of factors come together to make Southwest Center effective. Most importantly, it's our innovative and entrepreneurial spirit, which can be seen in the way we listen to and address community needs, and our earned income projects like the Clinical Trials Program and Vitamin Shop. But we recognize that this spirit has to be combined with a dedication to programs that are best practice and evidence-based, along with a commitment to adapting to national trends, including the National HIV/AIDS Strategy. Ensuring that we are operating high-quality, effective programs is of the utmost importance at Southwest Center for HIV/AIDS. We track completion rates for our services, use pre- and post-tests to measure the effectiveness of our prevention and education programs, and conduct surveys to track client satisfaction. And as a state and federally funded and licensed organization, we meet rigorous standards in a number of areas, including behavioral health and HIV testing. Often, people think of HIV as a gay man's disease. While it's true that the majority of cases occur among gay men, straight men, women, teens, and children are all impacted. Our goal is to work with everyone who is infected and affected by this disease. And this is reflected in our programming, which includes support groups for men and women, teen HIV education programs, and a summer camp for families who are affected by HIV. Since 1988, Southwest Center for HIV/AIDS has been on the front lines of the fight against this disease, preventing infection and improving the quality of life for people living with HIV. We are proud of our many accomplishments, including contributing to worldwide research and helping to bring 32 of the 34 available HIV/AIDS medications to market through our clinical trials program. Recalibrating our programs to match the national HIV/AIDS strategy, and creating a community health and education center at the heart of Arizona's most at-risk geographic area. Now that HIV is recognized as a chronic disease rather than the death sentence it once was, the sense of urgency around prevention and finding a cure has greatly declined, despite the fact that every 9.5 minutes, someone in the U.S. is infected with HIV. HIV is not going away and is, in fact, affecting some populations at truly alarming rates, including African Americans, women, and youth. Changes in federal and state funding priorities are also impacting our ability to provide comprehensive, integrated services like counseling to help deal with the devastating impact of the disease, social isolation and stigma, nutrition services to help counter the effects of harsh medications, and childcare to ensure that parents have a safe place to leave their children while they attend medical appointments. These are the kinds of services that can make a real difference in quality of life, as well as increasing adherence to treatment and ultimately reducing transmission of HIV. Southwest Center for HIV/AIDS has identified 4 key areas for expansion. First, increasing HIV testing is the key to early intervention and treatment. We need to broaden our scope of testing by targeting not only the general public, but also at-risk communities in the Phoenix metro area. Second, for those who test positive, linkage to treatment is critical. We would like to start a patient navigation program to guide newly diagnosed patients through the medical system and at the same time provide these patients with education designed to reduce further transmission. Third, expansion of our nutrition program will ensure that registered dietitians can help patients remain strong by eating a proper diet while on multiple medications. Government grants that once supported these programs have been severely reduced. Fourth, counseling is essential to helping individuals and families cope with the stigma and complex issues associated with this disease. We are committed to sustaining our specialized counseling program despite government funding cuts. A vital area of unmet need in Phoenix is housing for low-income HIV-positive individuals. While some federal assistance is available, the need for housing among this population far outweighs the available resources, leaving those who are HIV-positive vulnerable to housing instability and homelessness. This contributes to poor health outcomes, difficulty in following medical treatment, unnecessary exposure to potentially fatal opportunistic infections, and an increase in unsafe behaviors that risk the spread of HIV to others. Stable, affordable housing is a key component in a comprehensive HIV prevention and treatment plan. Southwest Center for HIV/AIDS would like to implement a feasibility study to quantify this need and develop a plan for action. With your help, we can make a difference. We can significantly reduce the spread of HIV and ensure that those who are infected lead healthy, fulfilling lives.